My name is Carmi Palafox, an urban planner and economist. Welcome to Beyond Places, the podcast about the planning, design, and leadership of the communities and cities that we call home. We're very excited to have with us our guest today. So, she is an independent consultant for health systems and policy for the past decade. Her expertise has been sought by government, nonprofits, and even the United Nations. So our guest is Dr. Lei Camiling-Alfonso. She's a volunteer specialist for the Philippine Society of Public Health Physicians, active in COVID-19 technical groups related to health policy, system strengthening, and strategy. Thank you for joining us, Dr. Lei.
Thank you also for having me, Carmi. I'm very delighted to be here.
Can you please share with us your work as a public health professional?
I started out my career as a doctor, as a public health physician, as a doctor to the barrio. So I was the only doctor in this remote island. It's beside Amanpulo. It's there that I learned that most of the things that patients come to you with, they don't get treated by giving them aerosol or pills, because you know that the source of that problem comes from the community. And what I had to do back then was to really talk with the stakeholders. What we see in the hospitals are just the tip of the iceberg. And in fact, when they come to you in the hospital, that may mean it's already too late. That kind of thinking, that integration, that systems thinking made me see healthcare not just limited to hospital practice, but on a bigger scale, which is public health, really. And in my work, particularly, it's about getting people to work together so that the people will feel the effects and the impact.
So after your work as doctor to the barrio, was that what led you to study your master's in public health in Belgium? And if you can please talk to us about that experience.
For me, that meant like I wanted to do this master's, and that master's I took it in Europe, because of the perspectives that they've had in Europe. I wanted to see how the welfare states organize their health system, and I want to see how it is like, because we are mostly familiar, say, with the US system, because we're
Mhm.
mostly patterned after the US, right? But the European system of delivering services and organizing policies and healthcare is very different. And I wanted to learn that, and that's why I went to Europe, particularly in Belgium, to do that in the Institute of Tropical Medicine in Antwerp. Antwerp is a very beautiful city, one of the most important European cities back in the day, and it's one of the most important ports. What I love about it, it's very livable in terms of you only need to walk where you want to go. Like you want to do the grocery, you can just walk. And then there's a lot of fresh produce wherever you go, just walking distance. And then it's very safe. And then what really shocked me when I first got there in my first week in Europe, I was trying to cross the street, and then I was second guessing a car. There was this European car. He stopped. He really stopped, no? Because that's how disciplined they are when it comes to pedestrians. It's very different how people look at streets, how they
Mhm.
utilize streets. There's a
Mhm.
lane for everything, and those things I really come to appreciate that, not just their health system.
We can talk about it all day, and I'm really as well like you really interested in how different cities, especially the more people-oriented cities, really plan their public spaces more for people rather than for
Yes.
cars. Because urban planners, we always say that places encourage people to walk, to cycle, to move, to exercise, and people are healthy. And I guess it relates to your point earlier. But I wanted to get your thoughts on how can we improve the way we design, from small towns to big cities so that we encourage people to be more active and as a result, more of preventing chronic illnesses like obesity and whatnot.
I think the key word is really enabling environments, and how this is implemented may be dependent on the context,
Mm-hmm.
uh, and on the existing infrastructure also in terms of how to implement. That's also where the pandemic has come in. Most of these efforts, the advocates that have been pushing for these have seen great strides in
Mm-hmm.
terms of achieving those. For example, bike lanes. Have you ever thought of having a bike lane in EDSA? Diba?
We've always thought about it and suggested it, but then it wasn't being implemented until
Right.
now because we didn't have a choice.
Because people now see it as a necessity, and even at this point, the political will and the condition of the environment, it's a very good synergy now to push for these changes. And
Mm-hmm.
and have you ever thought before that, oh, okay, so people are pedestrianizing certain areas, and maybe we've been doing this on little bits and pieces of the metro, but now these are already in the talks for some cities, and they see the benefit of that.
Is it safe to say that countries like the Philippines are having a hard time at controlling because the basics aren't even addressed yet, such as sanitation and housing conditions?
The Philippine health system, in fact, if you would look at the structure, it's not as weak as people want it to be, really.
Mm-hmm.
Objectively, we have very good structures at the local level. We are decentralized. What does that mean? The local government can act according to the local context, and that's very important in this pandemic. And in the Philippines, if you would look at it, is also an archipelago, and that also is a natural barrier against transmission. But then, how come we're not coping well yet? So, uh, there are various reasons, really. I could say, like, for example, in our context, the jeepneys. Actually, jeepneys are very good, good for
Natural ventilation.
exactly, they're good for natural ventilation. But because of what we do not know, and what perhaps the limited knowledge we had, many people wanted to put barriers, of course, in the jeepneys, etc., etc. And unfortunately, there are very few studies that can point really towards transportation as the mode of transmission, because those are very difficult to do. So normally, what you see would be household transmission. I'm not saying that it's just transmission through the transportation, but I'm saying that just knowing the mode of transmission and every day seeing people in the streets trying to get on a bus, trying to line up, I can say that I wouldn't want to be in those people's shoes. What we need really are options for people, safe options. And that's why we've been also pushing for the bike lanes. We've been
Mm-hmm.
pushing for, if possible, can we do remote work so people don't really need to go out? In our recommendations, we also do not sacrifice the evidence in terms of transmission.
So, Dr. Leah, a few years ago, I studied an urbanization course. We were talking about minimum housing size for affordable and socialized housing. And in the Philippines, it's legal to have just 18 square meters. So how can you social distance when you have just, 18 square meters of housing? So what do you think can be done at the household level, at the community level?
If you talk of, say, social distancing, you need at least 4 square meters around the person. So that's
Okay.
it's required, okay? And
Yeah.
then when they looked at Metro Manila homes,
Yes.
with around I think around 30%,
Yes.
30% of household cannot comply with that. The implications of this is that there should be a way to protect them should there be
Mm-hmm.
a case of COVID in that household. Then that's where your isolation units step in.
Mm-hmm.
And what we have also been recommending is that for those who can isolate at home. For example, you live in a mansion, you live in a house with 5 rooms. Why would you be taken out of your house, right? So
Yeah.
that should be the equitable decision making. So for those that have environments that can support isolation and quarantine, you allow it. So when I say isolation, it's about a sick person, a person who's already showing symptoms, that you need to
Mm-hmm.
separate that person so that she or he will not anymore transmit, right?
Yes.
On the other hand, quarantining means these are all asymptomatics. They're just waiting if they will get it or not, because either
Yeah.
they've been exposed to a coworker, they've taken care of a family member, or things like that. So
Mm-hmm.
these groups of people will need to wait it out for the next 14 days.
So I understand that you were one of the leaders for projects called Dictas COVID, and you worked with some of my colleagues in Palafox Associates and Architecture Group. Can you please talk a bit about that?
It was a really good collaboration. I would love to say that because this rarely happens. I would think the collaboration between urban planners and engineers, architects, and
Architects,
doctors.
yeah,
We realized back then that should people want to return to the provinces, right,
yes,
then there will have to be a holding area for them so that the
hmm,
community will continue to be isolated from the virus cannot come in. And that's how we reach out to you. So
yes,
back then we were thinking what would be the most common space in a community. That would be the basketball court.
and
And
it's
we
so
thought,
common.
yes, it's so common. Everyone has it, right? If you look at it, that's supposed to be temporary. Why?
Yes,
Because if the virus was controlled, all the influx coming in, right, they would be controlled, and then you won't have community transmission. And then later
yes,
on, the community will learn how to cope, look around its resources. Perhaps there's a hotel there that they can designate. I don't know. So it really depends on the context. One of the areas we work with in Mindanao, they have huts, right? So they're halfway homes for birthing moms. Because if the
yes,
policy now is that you cannot give birth at home, how about those who are coming from very far? Why can't you give birth at home? Because they've seen that many moms die at home, especially if they don't have the facility. So I'm just relating it now to giving birth. It's because the communities were able to adapt. What did they do?
hmm,
They constructed huts, right?
yes.
Halfway homes for those who need to give birth and to be near. So what I'm saying here is that there are many different options and configurations. And if you're talking about a nipa hat, the
Yes,
traditional home of Filipinos, it's a very well ventilated space, comfortable space, and that can fit in a context later on.
yes.
So yeah.
In terms of sanitation and hygiene, is there also, a study more or less on the urgency of addressing that?
There are no easy answers to that, and that's why we also need more innovators, more thinkers from the urban planners to work with us in public health. These things need concrete solutions, so I think that's where you can come in.
So here in Australia and other countries, there's been this concern about rising mental health issues. Is that a concern that's being talked about as well in the Philippines and in other countries?
We have to recognize that mental health is determined really by a lot of social determinants,
Mm-hmm.
and environment is one of them. And I think this is also where the built environment can help.
Mm-hmm.
For example, if you are living in a congested area and you are not allowed to go out, right? And that's the only place you know. And then, for example, there is an opening up of the economy, and then the only place to go to is a mall. That's so depressing, right? And
Yeah.
versus, for example, as we slowly open up, then you don't need to take the bus or the jeep because you can walk, and there's a
Yes.
park, right? So that is good for mental health. And and just having that space to go to, that option aside from the malls, it's a rarity in the Philippines to have those open spaces. To hear,
Perhaps my last
yes.
question, Dr. Lee, because it's been really challenging times, but people like you have really been in the forefront of keeping the discussion, making sure there are solutions immediately. So I wanted to ask you what keeps you going, what inspires you to really push for public health and better places.
I think it's the right thing to do when you're in a situation when you know that people want to help, and then you're in a position where you know also that you can connect people who want to help.
Yes.
And that's a beautiful thing. I think that's very inspiring. And there are so many people who want to help the country in this pandemic. And I think the challenge really is getting a seat on the table, you know,
Mm-hmm.
and and always being listened to get listened to.
Yes.
That's just reaching that point where your opinions matter, or just reaching that point where people give credit to the idea, not because of who said it.
That's so beautiful. Thanks so much, Dr. Lei. So it's been truly inspiring to speak with you. I enjoyed and I learned so much, and I look forward to collaborating with you more in the future.
Thank you so much and more
Thank
power
you
to you.
so much. Thank you. Take care. Thank you very much for listening to this episode of Beyond Places. I would love to hear from you. Feel free to connect with me on social media and carmipalafox@gmail.com. If you enjoy this podcast, please do subscribe. I would really appreciate it. Bye and see you again next week.